Good evening, everyone. I am Shimani Booker, here today to discuss racial and ethnic disparities in healthcare. Let me begin with a quote from Dr. Martin Luther King Jr. in a speech to the medical community for human rights. Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. Geographic location, ethnicity, education, environmental stress, and access to healthcare are all determinants of health disparities. These factors are influenced by the distribution of resources, wealth, and power. For many ethnic minorities, these factors impact their quality of life, ability to contribute to the economy, and the well-being of our nation. Discussing the 9 positions of the American College of Physicians is my team member, Mark Nashad.
I'm going to be discussing the 9 positions of the American College of Physicians, which the first one will be discussing how all legal residents with low income, no matter of their language, ethnicity, or race, should be able to afford health care. And the second position will be talking about how everybody should be getting good quality health care no matter of their ethnicity or language again. Third position will be talking about how physicians need to familiarize themselves with different cultures to be able to deal with ethnic diversity. Fourth position is how medical schools and health-related schools need to have physicians to be ready to interact with different ethnicities throughout their work. And then we got the fifth, which gives access to healthcare to everybody no matter of their ethnicity or race or language again. Sixth one, which kind of breaks down to a couple of points. First point, which works on education, pushes minority students and created a wider field of minority applicants to medical schools and health-related schools. And then second point, encourages medical schools and to put effort to raise the rate of graduating minority students and health programs that work on minority and support enrollment in medical schools and health-related schools as well. And then the third point, encourages medical schools to increase the number of minority faculty members and their staff. And then next point, supports minority to gain leadership positions in the medical institutions. And the last point of that position will be encouraging the increase of funding to programs that work on the increase of the number of physicians in low-income communities or minority communities. And then position 7 will be addressing social determinants that have a big role on, among minorities in education or job security. And then position number 8 talks about encouraging the help to create an environment with no mental stressors that harm minorities in any way. And then position number 9 on the last one will be encouraging the continuousness of the research that relate to social and minority issues of disparities. And I'm Mark Nashad with NBSTM.
Thank you, Mark. Now we have Nikila discussing the effects of the Affordable Care Act on health disparities.
Greetings, I am Nikila Foster, here to speak with you on the effect the Affordable Care Act has on disparities. Health disparities refer to higher burden of illnesses, injury, disability, or mortality experienced by one population group relative to another. Health care disparities refers to differences in health coverage, access to care, and quality of care experienced by one population group relative to another. The Affordable Care Act was intended to reduce disparities in coverage and in clinical care. Racial and ethnic differentials in coverage could be greatly reduced, cutting difference in the uninsured by more than half. Racial and ethnic minorities have higher rates of being uninsured, which is one of the significant factors that contribute to health disparities. Because of the Affordable Care Act, millions that were once uninsured now have access to affordable health coverage and also increases access to care. People of color are more likely to become sick with certain conditions. Many are preventable and can be effectively managed if detected early. Under the Affordable Care Act, health insurance plans must cover a list of preventable services at no additional cost, from annual checkups to screenings. The Affordable Care Act includes provisions that advance efforts to eliminate disparities. Because we have such a diverse population, healthcare disparities will always be an ongoing issue.
Now we have Tyrian here to discuss the importance of cultural competence and humility in the healthcare industry.
Hello, my name is Terry Ann Harry, and I'm here to discuss cultural competence and humility and how it is a major factor used to address racial ethnic disparities in health and healthcare in the U.S. A mission has been established to bring awareness and fill in the gap of racial ethnic disparities amongst minorities. It begins with the training of all healthcare professionals and their approach to effectively treat patients who represent different cultural backgrounds. So what is cultural competence and humility? Cultural competence in healthcare entails understanding the importance of social and cultural influences on patients' health benefits and behaviors. It includes having the ability to interact effectively with patients from different cultural backgrounds. It is a process of continual learning for healthcare professionals by being open and having an understanding of how culture influences the decisions that patients make on their health. As providers continue to learn in their fields about cultural competence, will guide all health professionals to recognize and apply their skills along with experience through awareness of cultural humility. Through the recognition of cultural competence humility, improvement of quality care and easier access in our healthcare system not only will be beneficial for minority patients, but for all Americans, narrowing the gap on racial ethnic disparities.
Wonderful, Tyrian. Now we have Brooksy McGraw here to discuss ethical decision making in the healthcare.
Hi, I'm Brooksy McGraw here with Erin, and I'm here to ask her a few questions. Miss Erin, if you could please answer for me, what are healthcare disparities?
I think healthcare disparities are racial inequalities in healthcare.
When it comes to healthcare, do you think for the community or the individual in ethical decision making?
I'm all about the community. That's why I'm a huge supporter of Obamacare.
Thank you very much for your time.
A healthcare disparity typically refers to differences between groups in health coverage, access to care, and quality of care. Health disparities in quality are not getting smaller. Legislation approved an IOM study on healthcare disparities that helped establish the National Center on Minority Health and Health Disparities. There are 4 policy areas reported in the yearly health disparity report that include 1. Raising public awareness, 2. Expanding health insurance coverage, 3. Improving the capacity and the number of providers in underserved communities, 4. Increasing the knowledge base on courses and interventions to reduce disparities. Where we have witnessed healthcare disparities have been in the case in King versus Burwell, where the legislation just proved insurance for all. Identify the central questions. Consider subsidiarity. Identify the relevant facts. Identify the salient values and moral concerns. Consider alternatives. Decide and justify. Follow up and review. Ethics is the careful study of standards of behavior that apply to real-world problems and decisions. There are 4 types of ethical lenses that help determine ethical decision-making. For the rights lenses is an ethical action that is doing one's duty and following ethical standards of actions. For relationship, it's an ethical action that will sustain integrity-building environments. For results lenses, this is an ethical action where the benefits of the action outweigh the cost. And for reputation lenses, ethical action that is consistent with a good character.
So, as we can see, healthcare inequalities not only affect the individual or specific populations, but they also affect the overall health status and healthcare costs of our nation. Many factors contribute to healthcare disparities, but quality can be improved if the appropriate resources come together and address these differences. We've all heard the quote, "It takes a whole village to raise a child," and in regard to healthcare disparities, we must bring conflicting entities together, stop procrastinating, and take the lead to make the necessary changes for improvement.